I will begin with asking you some questions related to the cardiovascular diseases and the risk identification. So, sir, what do you feel? How is the incidence of cardiovascular diseases in India as well as globally?
So, India, we don't have exact data, but from the US data, what we have is there are 4 lakh deaths per year in US dying of coronary disease. Out of them, 20% is between 45 to 75 years of age, and 25% is above 75 years of age. So it's a very huge public problem, and it's a big epidemic of coronary disease. Probably in India it's more than that, and unfortunately the age is younger groups, less than 40, less than 35, very common to have this coronary disease.
Okay, sir. So, sir, apart from age, are there any any differences if we compare Indian population versus the western part of the world?
The risk is we are getting at younger age in India, coronary disease, and we have a lot of smokers, and tobacco is the commonest cause. Second is diabetes and hypertension, and family history also plays a lot of role.
Right, sir. So, sir, according to you, what are the different parameters that are actually required to identify such patients who are at a higher risk of developing coronary artery disease?
Yeah, it's nowadays the US task force has developed a algorithm to find out what is the risk of coronary disease in asymptomatic patient. For example, somebody comes and tells a family friend of yours, doctor, can you tell me what is the risk of getting heart disease? So there is a app. In fact, one of the app is developed by me. It's called CV Risk, and we have developed in 12 Indian languages. It's available in all the languages. So you have to just it's a very simple app. You have to feed age, sex, non-Afro-American, and you have to feed total cholesterol level, HDL level, and are you on any antihypertensive medication, are you a diabetic or smoker. What this app gives you is what is the risk of 10-year risk of getting cardiovascular disease, and if the risk is less than 7.5, then you don't need any, you continue to have a good healthy lifestyle. But if it's more than 7.5, then it's something concern. So probably at that time you can go and visit your doctor. So what you need is just simple your cholesterol level, total cholesterol level and HDL level, and already know you're hypertensive, you're taking medications or not. So if it's more than 7.5, the risk of asymptomatic risk of getting cardiovascular disease, then you have to change your lifestyle, change your dietary habits, more physical exercise, and on the top of this you have to take statins, and this reduces your risk of coronary disease to less than 7.5%. And what I am telling is asymptomatic, that means they don't have any symptoms. Right. So there is no role for doing ECG, echocardiography, treadmill test. Just do this course. If the risk is more than 7.5, any public just can use this app and find out the risk of coronary disease. If it is more than 7.5, go and consult your physician and assess the risk further.
Right, sir. So, sir, as you are using this app since a long time, so how is your experience as far as the identification of the risk is concerned, and the specificity or as such any sensitivity of the app?
Yeah, it's a very good. It's a lot of. It is about a database from 19 trials. They have collected data, and with the data they have come out to this score. And what I do, in fact, in my practice is my secretary collects the data, and she in fact tells me before the patient comes to me what is the ASCVD score. If the ASCVD score more than 7.5, depending on the family background and depending on the family history of coronary disease, we can aggressively find out whether the patient is having coronary disease or not by even ordering a CT coronary calcium score. And if the CT coronary calcium score with more than 7.5, if the score is more than 1000, then the risk of coronary disease is 36% in next 10 years. That is very high risk. In fact, if it's such a high risk patient, asymptomatic, we have a lot of patients in my practice who are absolutely asymptomatic. ASCVD score is more than 10%, CT coronary calcium is more than 1000. We do an angiogram and they have a severe coronary disease. This is one of the way, and this is a very inexpensive way of detecting asymptomatic coronary disease, according to me. And it is data driven, it's not it's validated in a lot of the trials, and it has compared even the Framingham data also.
Okay, great, sir. So, based upon the identification of the CV risk and the score, which kind of a treatment you would like to recommend for patients with a score more than 7.5?
What I recommend always is lifestyle modification. It has to be the first priority. Lifestyle modification like dietary habits. You reduce your saturated fat, increase your exercise habits, stop smoking, control your blood pressure, control your diabetes, and top of it, if your ACVD score is more than 7.5, use statin group of drugs, and they are very useful. They reduce the risk. In fact, in the app, you can see if you change the lifestyle, the risk comes down. It will show how much risk comes down just by adding statins to this risk. So if somebody is having risk of 10 and you change the lifestyle, add statin, the risk comes down to less than 7.5.
Okay, great, sir. So
this
sir,
app is available both in the Google Store and Apple iTunes Store. Okay. It's a free app. The best part why I did is any lay person can use this. Let it be Malayalam, let it be Tamil, Kannada, any language they can use it. So a common man who need not know English or Hindi, any man can just use the app. It's called CV Risk Assist.
Okay, so it's a patient friendly basically.
It's a patient friendly, yes. It's a common man friendly.
Okay, so sir, in the era of technological development in medicine, do you feel that the applications like CV Risk app will definitely reduce the unnecessary costly investigations?
Yes, definitely. What I suggest is, in fact, any man, like you have in your apartment, neighbor is there, doctor is so expensive, tests are there, just tell him to use the app. And if it's less than 7.5, no need to go to a doctor. So he need not pay the consultation charges. So if it's more than 7.5, he can visit a doctor and then find out what's happening. So most of the people are screened out at that day itself.
Okay. So sir, lastly, if you want to summarize, what will be the key 2-3 messages you would like to give for CV risk detection as well as prevention?
If in India, especially with such a big population, you want to attack this epidemic of coronary disease, the best way is calculate asymptomatic cardiovascular disease score for every patient who comes to your clinic. Let it be mass clinic programs, let it be anywhere. Calculate those who are more than 7.5. Educate those people that even though you're asymptomatic, your chance of getting a coronary disease is high, and you have to take preventive measures, lifestyle reduction, smoking cessation, control of blood pressure, control of diabetes, and taking statin group of drugs.
Okay. Thank you, sir. Thank you for your time.